is more or less elaborate on these things, so we should be able to handle those issues. Yeah.
You talk about MDG 5, which is a big issue because it affects lives.
Yes.
And if you like, human generations.
Yes.
Because mothers go to
Yes, yes,
deliver,
exactly,
and that is
exactly,
what
exactly,
leads
exactly.
to the continue.
Yes.
How come we are unable to find a way around this challenge?
That's a very good question, and in fact, the sister-in-law of one of our colleagues just passed away. I never knew her, I never met her, never heard of her. But hearing the circumstances in which she died really hit me. And so I'm actually taking an unusually high interest in, of course I take interest in all aspects of development, but it hit me in ways that I hadn't anticipated before. I had dealt more or less with the numbers and I really put a face with it. But here's a young woman who walks into a hospital to give life, and somehow she doesn't come back out. Given what I've heard, there's a lot of work to be done because we pump a lot of money into the health sector. Next to education, that's the sector with the highest amount of budgetary allocation. The impression one gets and the stories we've heard, and certainly we need to pursue these, are that processes are not as efficient and responsive as they should be. It's not that we are not investing money, we are. But in the case of this young lady, for instance, there was a case of an ambulance not being available. So we bought the ambulance, it's there. It should be available. The person who should have been driving the ambulance was on an Easter picnic. And so they couldn't do that. And then the whole situation then snowballs into a completely preventable crisis. Eventually the young lady dies. And it has hit me in a way that I just cannot explain that. But I'm going to raise it with some of our commissioners. Professor Akosa is a member of the commission and others, for us to zero in on this, because we can't go on like this. Especially, it's not as if we're not spending or putting the resources. We're putting monies there. We just recently heard about the warehouse, pharmaceutical place that went up in smoke. Someone has to pay for this. It's simply not right. It's simply not right that people who are given life, your mother and I give us life, it must be a safe thing to do. Instead, you lose. Fortunately, for lack of a better term, her baby survived. But the tragedy repeats itself over and over. From what my colleague was telling me, 5, 6 people died in the 2-week span that he was there. And this was supposed to be one of the leading medical facilities in the country. So you can imagine what is going on in other parts of the country where facilities are less endowed. So we are going to put a spotlight on that, on maternal mortality, because it is the source of life. Without our mothers, where would we be? We wouldn't be here. So we need to put premium, and we are going to do that, not just because of MDGs or SDGs or somebody says that, but because it is the moral thing to do. It is the proper and right thing to do. We're going to pursue that within the next framework. We're laying the groundwork for the next medium-term development policy framework and so forth, but we are going to give it the attention that it deserves.
Now, you raised the subject matter, and it leads me to someone that I interviewed over the weekend who went to deliver the Kolebu Teaching Hospital, and because there was no ventilator for a premature baby, she lost the baby.
Yes.
And so it's like you said,
yes,
goes beyond
yes,
a particular case.
Yes,
it's something that is
systemic, and we need to work on that. In our new approach to development, we are going to look at what we call the soft issues of development, where we are looking beyond the physical facilities. We are looking at beyond the equipment. We are looking at beyond ambulances. Looking at the values of the people who control this equipment. What kind of rational, and what bothers me is that all these people claim in one way or another to be religious people. More often than not, oh, as for me, I'm a Christian, as for me, I'm a Christian. Just bogus Christians. Because they don't practice what they preach. How the hell do you leave an ambulance on the day you're supposed to be working and go to a picnic? And they had to do a lot of cajoling and money just to get this individual to come and drive the ambulance. First of all, there's there's something wrong severely with the setup, and we have to look into it. We will make a formal complaint to the Ministry of Health or Ghana Health Service for them to investigate that as part of the process of monitoring, because NDPC is also in charge of monitoring. We would like them to tell us what happened, because ambulances have their own regime for operation. You're supposed to have 3 shifts, 8 shifts each for 24 hours, and for each shift I think you have 3 or 4 people, the driver, a medical attendant, and so forth. I think 3 is the minimum. That's the practice worldwide. So how is it that there was an ambulance there, but the driver was at a picnic, and the young lady, 38 years old, lost her life? Why? And these people do that with such impunity. Every day you go there, they have to start with a prayer. While patients are dying, they insist on praying. And right after the prayers, they begin all the evil deeds. You cannot. So the issue, the matter of such issues, let us begin to examine ourselves. What kind of people, what values drive us? Is it hypocrisy that we're going to build this country on? Or should we care, even where money is not concerned? Should we go out of our way, the extra mile, and help someone, especially someone who's going to give birth? And it's just not that. I had a friend, Niadi, who recently, like a couple of years ago, walked into a hospital on his own strength and ended up being brought out as a dead body. We're all at risk. You just mentioned the issue of premature, and we are losing so many kids like that, which is unfortunate. I have a daughter who was born premature in the States, and sometimes I have a feeling I would have missed her if she'd been born here. And yet she's doing so well. She's very happy. She's doing well. I hope that she'll grow up to be able to contribute. But she said she wants to be a pediatrician. Hopefully she'll get to do that. But this is the situation. How many of our kids are we losing? People, sometimes I think the person who may actually find a cure for AIDS probably has died in a village somewhere in Ghana several times over because of this indifference to medical facilities. We also need to change our mindset as a nation. I look at the public sector employment benefits and regulations on one hand. There's a provision there that under circumstances the panel board would be set up to examine someone who needs treatment abroad. That means the mindset itself is towards not providing facilities for domestic medical, but for exceptional circumstances, certain people will be flown abroad. Rather than putting yourself in a situation where you're like, okay, no, we will create conditions here for maybe others to come here and not us to, and we can do that. We can do that. As I said, we put a lot of money into these things. So a lot of effort, certainly, but the results are not what they should be. So we need to begin to look at just the fiscal things we do. I've heard certainly of situations. I have a brother-in-law who's a medical doctor, and he tells me all these stories where people deliberately sabotage equipment that had been bought. So the government, the minister goes to parliament, announces, Mr. Speaker, we bought this and that. And after they place the machines there, someone deliberately removes parts from the machine because they don't want the machines to work. They want to refer patients to their private facilities or their friends or brothers or sisters facilities. Just sheer wickedness in a nation that's constantly making noises about godliness. We need to reconcile the two. We just cannot proceed on such hypocrisy and wickedness any longer.
Let's look at how we go into the SDGs.
Mm-hmm.
I mean, you've outlined some of the MDGs that we did not make the mark.
Yes.
And so how are we going into the SDGs with these unattended to, if you like, goals?
Even where we succeeded, such as improving gross enrollment ratios and whatnot, there are things, there's some unfinished business because we did improve enrollment ratios, quality somehow suffered and so forth and so on. So that's the next stage that we're looking at anyway before SDGs and so forth. But as I said, SDGs to a large extent are an elaboration of MDGs, and in some instances you can even tell it's 17 goals, but there are instances where you can combine even a couple of them, goal 1 and goal 2 more or less, one poverty, the other inequality. You can put these together, but for whatever reason they've elaborated on that. But as I said, we are not waiting for the SDGs. The issues on the SDGs are well known for the most part. The fight for poverty has been there for millennia, if you will. And we've been pursuing that. It was definitely on the SDGs. We just need to make more progress for those who have not been fortunate enough to be above the poverty line. The issue of inequality we need to pay more attention to. For instance, in recent times we've seen a great deal of growth in Ghana and some decline in poverty, but inequality has also gone up. So long before SDGs, we knew that we had issues that we had to address. But nevertheless, we are still willing to work within the context, the framework of the SDGs. The SDGs are just one of a number of frameworks that we need to operate in. The Medium-Term Development Policy Framework, GSGDA, 1 and 2, of course, the President's own transformation agenda, the coordinated program of social, economic and social development policies. We are looking to start the next medium-term development policy framework. There are spatial development issues that we are looking at. The spatial development framework that we're preparing, which is a 20-year period. We are preparing a national infrastructure plan, which will span about 30 years. Infrastructure is raised. So they complement efforts that we are looking at. But of course, it's global. So the issue of the global architecture, economic architecture, also needs to feature in the discussion. We need fairness in global trade, in the movement of resources and so forth and so on. Those are very critical if we are to develop the indigenous capacity to finance development. You don't want a situation where so-called donors are placing obstacles in your way in terms of your ability to export to their markets. Because whenever you put up these obstacles where we cannot export, and this has happened with one of the donors recently where they placed tariffs on shea butter. And so the price then goes up. Once price goes up, all things being equal, the demand will go down, so revenue will fall. But then you take that difference as a donor and then give us a little bit of the crumbs as aid. We need to be able to unravel all these contradictions in global economic and financial relations between us and sometimes not always even the advanced or industrialized countries. Some of the so-called allies also do that. So we will be pushing for that. Ghana, there are 3 broad areas. 4 actually, 3 are more strategies. One is the global economic architecture that I've talked about, that we need to keep discussing it towards a fair system, fair institutions, equitable institutions. But for Ghana, there are 3 other strategies or broad areas that we think need to be highlighted. They are not explicitly part of the goals, but they are like complementary efforts towards achieving that. One of them is the role of statistics in development. We believe that it is so critical. Without that, we'll not be able to, without adequate, timely, reliable, consistent statistics or data, we'll not be able to formulate the right policies, we'll not be able to make the right decisions, we'll not be able to assess progress or failure. And so building statistical capacities of countries, and in our case of Ghana, is very, very critical in terms of moving forward. Fortunately, there is the SDD, Sustainable Development Data Initiative, also as part of the SDGs initiative, and Ghana is strongly pushing for that. It needs to be given a lot of emphasis. There's the issue of domestication, or localization, I should say. Usually you have global goals, and then you can domesticate them at the national level, and then localize them. We need to pay a great deal of attention to localization. Too often we get obsessed with national statistics, but national statistics are aggregates or averages that hide a lot. We hear of GDP growth rate of 8% or whatever. Well, that means that in some sectors or in some parts of the country, GDP growth was probably 15 or 20%. In some other parts of the country, it was probably 3% or 1%, possibly even negative. We need to be able to disaggregate these things, not just in terms of space, but also in terms of demography. Are women doing well? Are youth benefiting? People with disabilities? We need to look at that at the local level. And that, of course, is related to the issue of statistics, because administrative statistics are generated at the local level. So if you strengthen local governance and you tag on to that the issue of statistics, then you have 2 for 1 right there. And then at the center of it all is population, demography, human beings. who are the ultimate objective of development. Who are these people? How many people do we have in Ghana? I keep hearing people referring to, 24 million people. I'm sorry, we are now 27 million, probably a little bit more. So when we keep referring to 24, if this is used by people in positions of authority, policymakers, we're writing off 3 million people. That's the entire population of some countries, in some cases several times. I've just learned that the population of Seychelles is 92,000. So if you sit here and write off 3 million, that's quite a bit. So we need to get a handle on that, the demographic aspect of development. Who are Ghanaians? How many Ghanaians do we have? What is the population structure? How many people join the population every year? And what are the implications for the provision of schools, for the provision of medical facilities, for the provision of other kinds of infrastructure? If you don't know all these things, you begin to flap in the wind, and that's what's happening. So these three strategies, we believe, and they're cross-cutting. They cut across everything, whether it's gender, whether it's health, whether it's education, whether it's infrastructure. They all work together, in addition to having a fair global system. We believe that these things need to be highlighted in order for us to be able to have a successful run at it. But let me also emphasize the fact that the SDGs are only a subset of other frameworks. SDGs will be for 15 years, but there are other frameworks I told you about, the spatial development framework for us, the national infrastructure plan. We are now laying the groundwork for a long-term national development plan for Ghana that will span 40 years, by which time Ghana will be 100 years old. There is also a 50-year framework by the AU called Agenda 2063. So this is all there, and MDGs or SDGs will simply fit in as one framework. As a matter of fact, the AU has made it clear that the SDGs will be subordinate to the Agenda 2063 of the AU, which makes sense because we are talking about 15 years versus 50 years. Yes.
The number of goals under the SDG 17, is Ghana going to be saying that we're going with all 17, or Ghana may want to add or subtract?
Well, the goals cover pretty much everything we are involved with. There's been, as one would expect, some controversy about the number of goals and so forth and so on. In fact, the Economist magazine referred to the SDGs as stupid development goals, partly because of that. But they are not really 17. They can be the Secretary General synthesis report proposes kind of aggregating them into 6 thematic areas or something like that. Whatever it is, all the issues listed in there, there could be 20 goals, there could be 6 goals, there could be 3. Every single issue features in one way or another in the National Development Framework. So that shouldn't really be an issue. The important thing is that they reflect in our own development policy framework. And they are limited anyway. As I said, we are looking at much broader issues, such as institutional development, soft issues, our belief systems, our cultural practices, our customer practices, the superstitions that drive us in this country. All those things are not featured in the SDGs, but we think as Ghanaians, based on our own unique circumstances, we should highlight them because they tend to impede progress. Here you have someone doing all the wrong things. They've set up a business, the business fails, it fails and fails and fails. And rather than retracing their steps and scientifically understanding why the businesses are failing, maybe they are not customer friendly, maybe the tomatoes are rotten and whatnot, they rather blame Ofienipa. So we need to begin to think scientifically if we want to progress. These are not explicitly stated in the SDGs as they stand now, but we think as a nation based on our own defined needs, these soft issues must form a critical part of our next development policy framework.
Now, there's a school of thought that has said that it looks like we spread ourselves often thinly, and so we are unable to achieve all the goals that we set for
we
ourselves.
being whom in this case?
In this case, Ghana. And so you're going for 8 goals, you're unable to deliver on all the goals. Now you have 17. Is it not obnoxious? What will be your reaction to that?
Well, the 17, these are global goals. We are part of the problem with MDGs is that countries, including Ghana, did not localize them as much. Because ultimately, development takes place in local communities. It doesn't take place in national capitals and offices of statistics. They are relevant. Those statistics offices are relevant. But it must be national development is an aggregation of local development. I just gave you an example of the sad story of the lady who lost her life. We need to begin to strengthen these institutions, the district assemblies and whatnot, to be able to provide these services more efficiently. So they need to be responsive, they need to be transparent, there needs to be some measure, some systems for measuring them. The local government service has just issued guidelines for service delivery in district assemblies. We want to build on that. There's also, before we even begin to draw up other plans, we need to do some sort of an evaluation and assessment of why certain things we said we were going to do, we didn't do, or we did but did not have the desired results. Because there's always been an implementation lag, or slack, if you will, in Ghana. We need to understand why. Is it because there's no money? Sometimes, yes, there's no money. But other times there's money, but it's simply not spent well. Through either waste or theft or corruption, whole range. We need to identify these issues and deal with them accordingly. So I don't think there are too many. Even if they reduce them to 3, it will simply be an aggregation of things that we'll be dealing with anyway. And I just gave you the example of 1 and 2. We can aggregate it into 1. That's poverty and inequality, which we're dealing with anyway. So we shouldn't get too caught up on the number of goals. Whatever it is, we will be dealing with those issues anyway. They talk about infrastructure, they talk about environment, all those things. We'll be dealing with them in one way or another. In which case we have more than 17 things to report on.
Now, financing is critical. I mean,
yes.
Whether or not we are able to achieve the goals will depend on how much we are able to raise and how we apply these resources. How does government intend to finance the SDGs?
Well, how does government, well, there's a global attempt at financing the SDGs. We will not be financing the SDGs per se. We will continue to work to finance our national development efforts, of which the SDGs will be a part. At the global level, in fact, there's going to be a conference in July in Addis. There's going to discuss how the SDGs will be financed. There are already some configurations being put out there: domestic resources, external resources, private resources, public-private partnership, all sorts of configurations. There are even those thinking of doing something about the capital flight from Africa and so forth and so on. But for us, those are all options, plus other options. We need to begin to tap into local capabilities for finance and development. So in the case of Ghana, we need to do more work in getting the Municipal Finance Authority bill out of Parliament. It's been floating there for all sorts of reasons. People think, well, the local the assemblies do not have the capacity, and we've been using that excuse for decades. Now, if the assemblies do not have the capacity, and so you're not going to give them the money, when are they going to have the capacity? It's just an excuse for the central government to just continue to maintain its hold on local government. So we need to aggressively push. That's what the issue of localization of development is critical. Aggressively push the issue of decentralization. Yes, there's going to be corruption, but there's corruption at the central level also. That's why we need institutions to minimize, if not eradicate, the issue of corruption, whether in central government, or in local government. But you cannot use the absence of capacity to withhold resources from the center. Then, and the central government wants to do everything, including building culverts, doing this. It cannot do everything. So, yes, there's a global search for financing model for SDGs. But at the local level, we also need to pay attention to our own thing. The issue of cost savings, efficiency savings, cutting waste and fat and whatnot must also come into play. Once, having been in government, I realized that yes, money is sometimes a problem, but it is not always a problem. Sometimes it's simply a waste of even the limited resources that we receive. And that if we do well, even with the limited ones, we can achieve a lot. I've learned that hard lesson once I come into government, and so as a result of it, I'm actually very happy that I joined government. Now I know, now I know.
Then once you raise the issue of government resources and how they are applied, one wants to take you to development partners.
Mm-hmm.
Over the last decade or so,
Mm-hmm.
their support to our economy has reduced considerably.
Yes.
Now, with the SDGs coming in and you're talking about various configurations,
Mm-hmm.
would these configurations lead to a situation where they free up support to government?
Well, not necessarily. They made a conscious effort to divert or at least limit their resources to Ghana as a middle-income country. As I can say, it's a area to operative. So basically, they're telling us, if you think you're middle income, then shoulder more and more of your responsibilities, and let's put our monies elsewhere. So that is happening. There was a framework we set up that was supposed to run for a 10-year transition period, during which we'll kind of wean ourselves of that. But in the meantime, we're still working with them. We just need to structure our engagement with them such that assistance from development partners facilitates the process of development, and that really becomes disruptive. It becomes disruptive when it's tied usually around projects. And I have a big problem with those kinds of things, where it's a project, they vote $3 million, $4 million. It looks good, but on paper, $4 million. But as soon as the money dries up, the project also begins to crumble. We have so many projects like that around the country. I believe whatever assistance we get from them should be aimed more towards building institutions, self-sustaining institutions, such that we'll be able to carry on even after the money runs out. But that's not always the case. So even there, it's up to us. They're not forcing us. They're not putting a gun to our head and saying, take our money. But we need to be selective as to what we get. We shouldn't embrace everything a donor partner brings in. We need to make sure that it fits our own priorities, and that once we take advantage of that, it will actually enhance our capabilities to do things for ourselves, not just you don't want a heroin kind of situation where you get your hit, you get your high, and then it goes down, and then you're out there trying to get another hit. No. So that aspect of our engagement itself needs to be looked at. What kind of aid is good, and what kind is bad?
We'll wrap up on this one, and what I would like to know is what mechanism will be put in place to carry the people along, because this is for the people.
Yes.
How do they get along with the implementation process?
Terrific. We've already had 2 main consultations specifically on the SDGs, but even before the SDGs, we had national consultations on the Medium-Term Development Policy Framework, GSGDA2, and we intend to do that again with the next Medium-Term Development Policy Framework, and more importantly, with the Long-Term National Development Plan, which, as I said, has a 40-year time span, 4-year plans, 10 4-year medium-term plans. And we are going to do that on a grand scale. It's going to be launched. It's going to be publicized. We're going to use social media to engage Ghanaians both at home and abroad to get their ideas as to what they think the ideal situation in Ghana should be by the time the country turns 100. That means we need to involve a lot of young people. They are the ones who shall inherit the earth, so to speak, by 2057. Some of us may be somewhere else, maybe looking at them and cheering them on. But it has to be an open process. And I'm saying that because I was recently in Lusaka, and we're discussing the Agenda 2063. And a young man actually walked into the conference and reminded us that most of the people in the conference room would not be around. So we better pay attention to the youth. So we definitely involve very young people, because by 2057, when Ghana will be 100, the president then is probably in St. Roses by now, or
obscure corner.
yes, somewhere